Hello, I'm Natalie Kunsman, MD, and today's discussion is for you men, but behind many men are some well-informed and well-intentioned women, so ladies, listen up too. We're going to discuss low testosterone. So, testosterone is mostly produced in the testes or testicles, and to a very small degree in the adrenal glands. And women make a little bit of testosterone in the ovaries and the adrenal glands, but today's discussion is mostly regarding men. So the normal production of testosterone is anywhere from 250 to 1100 nanograms per deciliter. And this is very low amounts in the body, but they do a lot in the body. So you have total and you have free testosterone. And every now and then in this conversation, I may refer to testosterone as T, which is what we discuss in the business. So some of the testosterone is bound up with protein carriers, which are called sex hormone binding globulins. And there's a very small amount that's also bound to the cortisol binding globulin. Free is obviously that free testosterone that's not bound up to any of these carrier proteins. And only the free testosterone or testosterone that's bound a little bit to some albumin will actually work for those functions in the body. So if testosterone is bound to that sex hormone binding globulin, it is bound so tight that it is not bioavailable for any activities in the body. So testosterone levels actually change throughout the lifespan, and they start declining at around age 30 years old. So we will need to talk about those things that actually diminish the total testosterone and those that will change or alter the sex hormone binding globulin. So symptoms of low testosterone will actually depend upon which phase of life we are talking about. So we can go back as far as embryologically. If the testosterone is low, the males may actually have feminized genitalia, or they may have underdeveloped testes. So as we march along, if we're talking about low testosterone in the puberty time frame, some men may actually fail to achieve puberty symptoms such as the deepening voice or the hair growth or lack of body hair, and may actually get some male breast tissue. Now, as an adult, if you get older and we have lower testosterone or you have lower testosterone, this may actually be considered andropause or hypogonadism in a very generalized term. And when that happens, we may notice some low muscle mass, infertility, erectile dysfunction, a diminished sex drive, slow hair growth, or actually body hair loss. There may be bone loss, which is something that we don't often think about. Gynecomastia, or the slang term is man boobs, that may become apparent. Mental fatigue, mental fogginess, and I've actually noticed that most of my gym goers will notice a decreased amount of reps or actually having to reduce the amount of weights for the weightlifting. So we're not really going to talk about some of the inherited genetic patterns like Klinefelter syndrome or true pituitary disorders. But we will actually talk about low testosterone as far as being a primary disorder or a secondary disorder. So the primary disorders are those that actually directly affect the testicles themselves. So there are inflammatory conditions, infectious illnesses that can harm the testicles. And years ago, we used to concern ourselves with mumps because that was one of those infections that would affect the testes and render them inactive or faulty. There's actually trauma that can affect the testes. Cancer treatments and chemotherapies can dramatically affect the testosterone being produced at the testicular level. And then, of course, we have the secondary disorders that are those that might affect the pituitary or the hypothalamus, which is up in the brain. So the hypothalamus will secrete a gonadotropin-releasing hormone, and that will talk to the pituitary that will secrete luteinizing hormone or follicle-stimulating hormone, and then the pituitary will talk to the testicles. So HIV and AIDS can affect the hypothalamus or the pituitary. There is a normal aging process with the pituitary such that FSH and LH may be much more dramatically decreased in its secretion. Obesity, there are actually medications, and hold on to your hats with this one because I want you men to pay attention to this. Some of the biggest medications that will block the hypothalamus, which will shut testosterone production down, are the opioids. And opioids, I think most people know, are some of those chronic pain medications. We talked about this in our statin and cholesterol discussion, but statins, by nature of breaking down or slowing down cholesterol production, that cholesterol is actually needed as a substrate to make testosterone. So the statins will lower testosterone by blocking that substrate. There are actually severe emotional and physical stressors that can affect the hypothalamus and the pituitary. We have excessive alcohol consumption that has some proposed mechanisms such as potentially either breaking down the walls of the testicular cells themselves or blocking at the hypothalamus and pituitary level. So that was things that will directly affect testosterone production or secretion or discussion from the brain to the testicles. But then there are also issues which may change that sex hormone binding globulin. And as a reminder, if the sex hormone binding globulin is low, there would be more free testosterone around. And the opposite would be true. If we have sex binding hormone globulin that is high, we have it tightly bound to the testosterone, and less of that is able to be used for functioning in the body. So some things that may actually lower the sex hormone binding globulin would be obesity, insulin resistance, hypothyroidism, and Cushing syndrome, which is an adrenal dysfunction, which is quite complicated, non-alcoholic fatty liver disease, acromegaly, and androgen steroid use. And sometimes these conditions in its beginning or middle phase, depending how dramatic the condition is, could actually give you some signs of excessive steroid. Now, there again is the high sex hormone binding globulin phenomenon that would bind up all your testosterone, making it very low and not available for body functions. And that includes smoking, excess alcohol, extreme weight loss, cirrhosis, and those conditions will indirectly affect how much testosterone is available to circulate in your tissues for the functioning. There are actually natural ways to enhance testosterone, and these are some of the basics of life and what I would describe as epigenetic functioning. So some of the natural ways to enhance testosterone is improved sleep, getting a reasonable amount of exercise, cutting weight such that we're trying to decrease obesity, adding some zinc, which is a cofactor, cutting down sugar, cutting down some of those meds that we talked about in the beginning, in particular statins and opioids, and cutting down booze. So let's say you have been tested and you have been having some signs of low testosterone and you need replacement. There are several different ways to go about testosterone replacement and things we need to think about. So the first ones that most people are familiar with are injectable compounds of testosterone, and that includes testosterone cypionate, enanthate, propionate, and a simple testosterone suspension. So the advantages of those is they have a sustained release mechanism such that they may stay in the system for a few days or up to a week or two. And yes, these are injectables, and it will require a needle into the butt. Then we have things such as, a common trade name would be androgel, or topical compounds. And obviously, those have a vehicle of rubbing the cream into the skin, which absorbs into the fatty layer just in the subdermis and dermis. And there will be some obviously good benefits to replacing testosterone, and some of that would be improved sexual performance, a stronger physique, a leaner physique, increased energy, improved mental functioning, much improved sleep, a stronger immune system, and an improved, I'll just say, outlook or disposition. But if we are replacing testosterone, there are some side effects or cautions of replacing testosterone, and that would be in the line of excessive testosterone or the estrogen effects, which we will be talking about. So I will say that most times, if replaced in normal levels, this is not going to cause a side effect profile because we are replacing a compound that is not foreign to the body. We are replacing testosterone losses with testosterone. But if in excess, men, you may notice fluid retention, believe it or not, a low sperm count, increased weight gain, and a lot of times that comes from an increased appetite, increased muscle mass, but unfortunately you may notice some mood swings, or what in the slang terminology is called roid rage. You men may notice acne, accelerated hair loss in some of those areas that are predisposed to normal male patterned hair loss, such as baldness, and then potentially a reduction in body hair. I notice quite often elevated hemoglobin levels. And then we have the potential for the estrogen side effects. So what happens very briefly is when the testosterone is circulating and going to the tissue, at the cellular level, testosterone can do something that's called esterification, which can, or I should say aromatization, which will convert some of that testosterone over into estrogen. So androgel is a common one that may have some estrogenic side effects, but honestly, any of the injectables could have the similar effects. So there is a way to combat that when we are replacing it. Now, if we have the estrogen side effects, this can cause some of the very common effects that men notice, which would also be some excessive water retention and gynecomastia, such that there may be some breast tissue development. And occasionally there can be some high blood pressure if that gets itself out of hand. So the anti-estrogen medication that can be used to combat this can either block the estrogen effect at the cellular level. So blocking an estrogen receptor to turn on is more in the line of Nolvadex and tamoxifen. But then there are the aromatase inhibitors that will actually prevent the conversion from testosterone over to estrogen. So the cell wall blockers don't really change the estrogen amount. They just try to prevent that from getting into the cell. But the arimidex and aromatase inhibitors will actually cut down any of the estrogen that's being made. So we have some basic bottom lines here. I would basically say, for you men, if you're having any suspicion that your testosterone levels may be low, find yourself an integrative physician, and I would specifically say a physician, and get your T levels checked. You want to optimize your testosterone wellness program, which is some of those strategies I mentioned in the beginning, such as those lifestyle modifications that make a dramatic impact in improving testosterone throughout the lifspan. I also strongly recommend that you get it prescribed from a reputable source rather than a gym. And I have seen many cases of men coming in with poor sources, and we are unsure what the binding mechanisms and what the salts and what the suspensions are and where the medication is coming from and if there's any other harmful effects. Plus, I've seen severe over-the-top overprescribing and men having a lot of the steroid manias and altered biochemical functions from simply too much and proper and poor quality testosterone. If you have any questions, please submit any questions you have below in the comments section. Of course, I would love for you to subscribe to this channel so that you have access to all of my other health topics. I am always receptive to addressing any concerns that you have on your mind, and testosterone is a big one that comes into my office on a weekly basis. So until we meet again, be well.